Hi, I'm Sarah. Welcome to the Hospo Health Program. People who use alcohol and other drugs won't always experience serious issues, or it may take time for these issues to develop, which means that the signs that they are struggling with their alcohol or drug use aren't always obvious to someone else. But sometimes there are a few hints that your co-worker or mate's alcohol or drug use is having an effect on their everyday life. These can include turning up late to work or missing work altogether, not working at their usual capacity, maybe they seem more forgetful, tired or zoned out, not responding to messages or calls, always asking to lend money, having family issues or relationship problems, including interpersonal conflicts and issues at work. If you work closely with the person, there may be some other signs that you pick up on, or perhaps they've already spoken to you more directly about it and said things like that they've been using drugs or drinking more, that they need more and more of a drug to get the same effect, that they've been using drugs or alcohol to avoid withdrawal symptoms or to cope with other life difficulties. They might also have other co-workers, friends or family members who are concerned about them. In fact, it's often family and friends who first recognise that a person that they care about has alcohol or other drug-related problems. So how can we talk with a co-worker or mate who may be struggling with alcohol or other drugs? First of all, it's really important to keep in mind that many of the signs that I've just described can happen for reasons other than alcohol or drug misuse. So it's really important not to jump to conclusions or make judgments about their behaviour. Instead, coming from a place of concern and wanting to offer help is usually far more effective. Keeping some of the following tips in mind might be helpful for approaching someone you are concerned about. Firstly, plan a good time when you won't be interrupted and where you'll have some privacy so that the person feels that it's safe to open up. Focus on their well-being and what you've noticed, rather than their use of alcohol or other drugs. Try to avoid appearing judgmental or lecturing. We're all less likely to respond positively to this approach. Offer options for support. Sometimes it can be really overwhelming to know where to turn to for professional support. So helping your co-worker or mate navigate this step can be really helpful. I've provided links to some really good options for professional support in the downloadable handout, so it might be useful to check these out first. It might also be helpful to see if your workplace offers access to free and confidential support, such as an employee assistance program, as a first step to accessing support and treatment. Be ready for a negative reaction. Your colleague or workmate might not see that their alcohol or drug use as something to be concerned about at this point in time. If they're not interested in talking, let them know that you're there if they change their mind or ever want to talk. And importantly, look after yourself as well. Being a support person can be tough at times, so you might find it helpful to talk with someone about how to continue to look after yourself, as well as how to best support someone that you're concerned about. So that might be your manager, a trusted colleague, a GP, or a counsellor or psychologist. Becoming dependent on alcohol or other drugs can happen to anyone, and it can be very difficult to stop once your body and mind start relying on the substance to function properly. A great first step for someone concerned about their substance use is to talk to someone they trust and reach out to a support service. Even if your co-worker or mate does get professional support and treatment, your role as a support person doesn't have to end. There are a number of ways you can continue to stick by them while they attempt to change, including celebrating their efforts to change their alcohol and drug use, encouraging them to engage in healthier habits and coping strategies, and being a patient and understanding source of support.